So today I'm going to demo a physical assessment, and I'm going to do it by body system. So the first system I'm going to do is the patient's head and neck, their skin, and then just their overall general appearance. So I'd start by knocking on the door, washing my hands, providing for privacy, and raising the bed up to a good height. Hi, Miss Gray. My name is Maddie, and I'm going to be your nurse. Can you please tell me your name and your birthday? And she tells me it's Allison Gray, 10/3/78. Okay, I'm going to do a physical assessment on you today, and that just kind of involves me listening to your heart and lungs, checking you over, looking at your skin, listening to your stomach. Is that okay with you? So she was able to tell me her name and date of birth appropriately, so that tells me that the patient is alert and oriented, that she knows what's going on. I would also take note of her behavior, how she's acting. Is she calm? Is she anxious? Is she tearful? Is she withdrawn? Those are some things that I would look at. I'd also go ahead and look at her general appearance and her hygiene. Does she look well kept? Does she look like she takes care of herself? Does she look clean? Just some different things like that. I would not go ahead and do a full hair scalp assessment unless I felt like the patient's appearance warranted me to. So overall, her general appearance looks good. I'd also already kind of know what the patient's vital signs were going into this, what their height and weight was, and all that. Okay, so the first thing I'm going to do, Miss Gray, is I'm going to shine a light in your eyes. So I'm going to check for perla at this point. So I take the light, I'd open both the patient's eyes, and I'm going to shine it in the left eye, and I can see that the pupil reacted to light. Then I'm going to shine it in the left eye again, but look at the right eye, and I can see that that pupil constricted as well. So that means that that pupil accommodates. I'm going to do the same thing over here on the right eye. I'm going to shine the light in and look at that pupil. I'm going to shine the light in again and look at the other pupil, and it seems that both pupils react and accommodate to light. I would also ask the patient if they were able to, if they could get up and just walk for me just a few steps, or if they were in a chair, I'd ask them to walk from the chair to the bed so that I could take note of their gait to make sure that it was smooth, that it was steady, that they weren't shuffling or having difficulty walking. So the next thing I'm going to do is assess the patency of the patient's nares. Ms. Gray, I'm going to check the patency of your nares, okay? So I'm going to close this side of your nose. Can you breathe in for me? And I'm going to close this side of your nose, and can you breathe in for me? Did you notice any difficulty doing that or any stuffiness? She tells me no. I'd also want to go ahead and look in the patient's nose just to make sure it was moist, that not dry, make sure there were no lesions in there. I'd also look to see if there were any obstructions, if one side was smaller than the other, anything like that. And now I'm going to go ahead and take a look in the patient's mouth. Can you open your mouth for me? And I'd look at the tongue, I'd look at the teeth, I'd look at the mucous membranes to make sure that they were pink, moist. That indicates that the patient is well hydrated. I'd also look to see if they had any missing teeth, if they had dentures. Teeth can also be a good indicator of a patient's hygiene status as well. Everything looks good in here. Can you smile for me, Ms. Gray? Her smile looks equal, no drooping or anything like that. Okay. I'd also want to check to see if the patient had any trouble with her vision, so I would maybe ask them to read a clock on the wall. I would see if they were able to see the TV okay, if they happen to be reading a book or a magazine or their phone or anything like that and weren't having any difficulty, then that would kind of give me an indicator of their vision. I also want to look at their ears, make sure nothing abnormal, make sure they had no hearing difficulties. I'd ask the patient that. I'd want to look at hair distribution throughout the whole body. Is there excessive hair distribution anywhere? That can be an indicator of some problems, different things like that. So now I'll take a look at the patient's skin. I'd want to touch it, and it feels warm. It's not cold, it's not hot. It feels moist, and she's not diaphoretic. She doesn't have flaky skin or anything like that. The color is within normal limits. She's pink, it's appropriate for ethnicity. She's not cyanotic. She's not red anywhere. I also would look to see if I noted any excessive bruising, any skin tears, any lesions, any sort of just openings or anything like that. Her skin integrity looks good. Next, I take a look at her nails, and this could tell me a lot about her hygiene and health status as well. They look clean and well kept. They're a normal color. Sometimes if patients have trouble breathing, trouble with any sort of oxygenation issues, they can be cyanotic or they can be misshapen. I'd want to go ahead and check her cap refill, and it is brisk, less than 2 seconds. It is over here as well. All these nails look good, so she looks good there. And then the next thing I'd want to do is go ahead and check for edema, which is swelling. And the way we do that, the way we check for pitting edema is just by pressing with 2 fingers to see if the skin indents any. And we usually do this on the lower extremities, or upper and lower extremities. So there doesn't appear to be any pitting edema on her arms, and there doesn't appear to be on her lower extremities either. And you usually test around the ankle. And if she were to have pitting edema, the way we usually rate that is 1+, 2+, 3+, etc. And it's by how many seconds it takes for the skin to go back to normal after pressing on it. So if it takes 2 seconds, then a patient has 2+ pitting edema. I also want to check too, sometimes patients are just generally edematous or swollen just throughout their whole body, not in certain spots, and that's just known as generalized edema. And she doesn't seem to have that either. I'd also want to go ahead and check the skin on her legs and her feet. I'd want to feel them. They also feel warm to the touch. I don't notice any discoloration. I don't notice any sort of lesions or openings anywhere. It's on her feet, legs aren't excessively dry. A lot of the times people with poor circulation, diabetes, have discolored lower extremities, and you can tell a lot about their health by their feet and their legs. So all that looks good down here. And that's it for the first assessment.